Zampu, my name is Srijanal Rai and I am pursuing my study in B.Sc Animal Science, College of Natural Resources. Today I'll be talking on one of the viral disease known as rabies. It is prevalent in most of the country and it is also known as hydrophobia or canine madness. I'll be going through introduction, epidemiology, etiology till the prevention of and control of this viral disease. So, we know that the rabies is known to be an acute zoonotic infectious viral disease in case of both human and warm-blooded animal. It is usually characterized by the abnormal behavior, nerve disturbance, impairment of the consciousness, paralysis, and leading to the death of an animal or the infected host. And in our local term, it is known as Bawlani Rog, our local term Losamkha, and in our national language, it is known as Chalni. Japan is the first country in Asia to eradicate the rabies, and in our country, the outbreak often occurs frequently in the southern parts of our country, in the domesticated animal and especially in dogs. And vampire bats are known to be the primary host carrying this virus, and this major zoonotic disease has been prevalent in our country since 1996, and we all know that the World Rabbit Day is celebrated on 28th of September. Now the etiology. Rabies is caused by RNA virus belonging to the genus Lyssavirus, which falls under the family Rhabdoviridae. It is bullet-shaped and it is differentiated into two, that is fixed virus and street virus. Now let's go through the brief difference between these two viruses. Fixed virus, the incubation period is shorter, like that. In case of the street virus, the incubation period is viable. In the fixed virus, they do not produce naked body like that of the street virus, and there is an absence of the virus in the salivary gland, whereas the street virus, the virus has got an affinity to multiply in the salivary gland. And fixed virus is not virulent like that of the street virus, which have a virulent effect in the human. And for the vaccine preparation, we use fixed virus rather than the street virus. Now the susceptible host. All the warm-blooded animals, including some domestic animals and man, including the bird, are susceptible to this viral disease. Now the mode of transmission. Some of the major mode of transmission includes bite of an rabid animal, lick, scratches, and infection through the aerosol route, and consumption of the contaminated meat of the rabid animal. The incubation period ranges from 5 days to several. It may also include 20 to 60 days, but some animals die prior to the clinical sign. In rabbit, the incubation period varies depending upon the several factors such as the site of bite, which means the distance from the brain. Example, like in a man, the virus can reach brain from the facial wound in 30 days, and from the arm it takes place 40 days, and from the leg it takes place 60 days. The severity of the bite, age of an animal, and amount of the virus injected, and the species of biting animal. Now the pathogenesis. It starts with the introduction of the virus in our body or any host animal through a bite of the rabbit animal, or through the vampire bat, or through the consumption of contaminated meats. And this virus multiply in monocyte, epithelial cell, and connective tissue, and this secondary tissue becomes severely infected, and the neuromuscular spindle, which provide an important site for the entry into the nerve system, becomes severely infected by this virus, leading to the spread of the virus from the infected site to the central nervous system and the spinal cord. Thus, this virus may also reach to the several parts of our body, such as salivary gland, thymus, lymph node, taste bud, and other parts. Now, the clinical sign and syndrome. The clinical sign usually is manifested in two forms. First one is furious form and the dumb form. Now, as a whole, in general, the clinical sign in dog includes loss of appetite, fall in milk yield, paralysis of the muscles around the jaw, of the face, and also the neck. Their vocal cord also become paralyzed, and salivation and grinding of teeth, difficulty in drinking water, sign of choking, and chasing of any moving objects. Now, the clinical sign in the pig. They become anorexic and formation of the form as you can see in this picture, and they often act violently and furiously, and they attempt to bite any accessible object around them. Now the furious form. The furious form comes into two stages, that is stage of melancholy and stage of excitement. Now the stage of melancholy. It lasts for 1 to 3 days, where the animal tend to bite and inanimate objects, and they fail to respond to their master calls, and their pupil dilate and change in facial expression, and they often bite the object that is nearby, and they stand in fly catching posture, and they are unable to drink due to the paralysis of the pharyngeal and laryngeal muscle, and salivation from the mouth, where the saliva is hanging from their mouth. Now the stage of excitement. The stage of excitement usually lasts for 1 to 7 days, where the dog become extremely aggressive, and they become photophobic and hide in the darker place, and they try to hurt themselves by breaking their teeth and injure their gum and head, and often paralysis of vocal cord takes place, and drooling or saliva. They wander aimlessly, and they often bite the other animal or human, and they show some of the signs of emaciation and exhaustion, and muscle tremors also occurs. Now the dumb form. The dumb form is also known as paralytic form, where the paralysis of the jaw, tongue, and the paralysis of the throat muscles takes place, where they are unable to bite, unable to open their mouth or eat. So they become extremely sluggish also, and progressively weak, and sometimes they also come into coma, and then death occurs. Now in case of the human, they show an abnormal sensation at the site of exposure. They have a mild fever, headache, and hypersensitivity, lacrimation, salivation, and eventually due to the paralysis of the respiratory tract, the death occurs. Now you can see some of the image of the rabbit animals showing some of the clinical signs, such as salivation from the mouth, becoming extremely aggressive, and sometimes they tend to hide themselves due to the photophobic condition, and that occurs due to the paralysis of respiratory tract and jaw muscle, throat muscle, and due to some severe infection in their secondary tissues and all. Now the diagnosis. The diagnosis is carried out due to the history, if the animal has been infected by other disease or not, knowing the history of the animal and the clinical signs shown by the animal, and the tests that we run out, such as FAT, that is fluorescent antibody test, and polymerase chain reaction PCR, and complement fixation tests. These are some of the tests that we run out to sure that the animal has been infected by the virus. Now the treatment. First is post-exposure treatment, the local treatment of the wound, which is immediate washing and flushing with the soap and water. And second one is post-exposure immunization. This treatment consists of the 5 ml injection by subcut or intramuscular. This is an anti-rabies vaccine, and if someone is bitten by the rabbit animal, then it is advisable for them to complete their course. The course consists of the 5 dose of the medicine. So it is really important for them to complete their course. And in case of the rabbit animal also, they also contain the course of 5 doses, and they should take in an alternative days where they should be vaccinated in alternative days, such as if you are vaccinated in day 0, then next it will be day 3, then day 7, day 14, day 28. As I said that it is a dose of 5 for one course, so it is really important for everyone to complete their course. Now the prevention and control. A prevention of the rabies can be controlled uh, by practicing CABC, that is animal birth control. In Bhutan, we carry it out every year, that is sterilization program and all, and strict quarantine measure, that is quarantine of the infected animal, and creating an awareness among the society through mass media so that they become more careful and conscious about everything, and DHA PPI vaccine, then registration of the pet dog. So the information that I extracted was from one of the book written by our Bhutanese author. Thank you and stay safe. Don't forget to wear your mask and don't break the lockdown rule, and stay safe.